Of course, during these challenging times, both in our community as well as our national society, nothing's more important than our health, our mental and physical health. Well, to help us cope with such challenges, delighted to welcome to Midday with Mike, Dr. Lionel Phelps. Dr. Phelps is with RiverValley Behavioral Health. Doctor, thank you for joining us. I understand our mental health can really affect our physical health. Explain.
Yeah, absolutely. So in years past, we really looked at psychological well-being and physical well-being as being two separate factors. That's no longer the case. We integrate our psychological and our physical health now to where when we're treating the person, it's more holistic. So we make sure that we treat both of those.
And of course, conversely, our physical health has a terrific effect on our mental health, right?
Absolutely. We know that people who are dealing with cancer or cardiovascular heart disease or things like psoriasis often are very impacted by things like depression or anxiety or just severe stress.
How important is it to prioritize or to put our physical activity in order?
Well, with our physical activity, and I'm assuming you're talking about physical exercise.
Right, right.
Yes. So, having things that doctors have been telling us for years, making sure that we have some form of cardiovascular exercise every day, or strength training, eating a good diet, getting enough rest, all of those factors have significant roles to play in our physical health. And in turn, that impacts how we feel with our psychological well-being.
And of course, the older we get, but especially even when we're young, the importance of sleep. Tell us, Dr. Phelps, boy, we just have to get enough sleep, don't we?
We sure do, and it's a real challenge. REM sleep is more difficult as we age. We know that teenagers just don't get enough sleep these days, and often it has a lot to do with being plugged into technological devices and things like that nature. But anyone that can really shoot for that 7 to 8 hours of good quality sleep every day is going to benefit tremendously.
Something too, it seems like many of us will diet from time to time. Doctor, talk about maintaining our weight, why that is so important.
Absolutely. So we know that often people who are also struggling with things like depression and anxiety have higher rates of obesity. And often that is attributed to just poor diets, poor weight management. So, eating lots of good, great whole grains, fruits and vegetables, not skipping meals. And, I know that one of the fads today is to fast. And that may work for some people, but as a whole, skipping meals is not a good thing. And it can certainly lead to, less brain function, the ability to just think clearly. Some people report being in kind of a fog from skipping meals, drop in blood sugar. All of those things are attributed to just poor diet.
Real quick, the best way to get hold of RiverValley Behavioral Health.
The quickest way you can get a hold of us is 988. So we went to the 3-digit dialing on Saturday, July 16th. You can also call 1-800-273-TALK.
Again, our thanks, Dr. Lionel Phelps with RiverValley Behavioral Health. Doctor, thank you very much for your insight.
Thank you, Mike.
You bet.
Pleasure.
And when Midday with Mike continues, Dr. Dwayne Ackerman with Ackerman Chiropractic is on deck. We'll talk to that doctor right after this.